Magandang araw po muli. Pagpapatuloy po natin ang ating pag-aaral tungkol po ulit sa ating dugo, sweat, blood. Number 11 na po tayo. Tingnan po natin ano ang heat in the blood. So pag may init sa dugo, at ito po yung clinical manifestation. Feeling of heat, skin diseases with red eruption. Yun, napakausap po ngayon. Tapos nauuhaw, merong bleeding, may red tongue, at saka rapid po yung pulse. If heart blood has heat, yan, kung may init po yung puso natin, ito pang nararamdaman. Meron tayong anxiety, mental restlessness, hindi ka mapakali, at may mga mouth ulcers po. Yan. Kung liver naman po ang iinit o liver blood has heat, so ito po yung makikita natin, magkakaroon tayo ng skin diseases characterized by itching, yun, yung makakati po. Tapos merong heat at saka redness. If blood heart affects uterus and penetrating vessels, ito pang makikita natin kung may init. Excessive blood loss during periods. Yun, napakalakas na menstruation. So, if there is blood heat in intestines, sa ating mga bituka, nagkakaroon po ng dugo ang ating mga dumi, blood in stools. Yan, tag-init nararanasan. So, feeling of heat, sa magkakaroon ng skin diseases, malalaman nating heat po pag may mga red colors, red eruption, tapos uhaw tayo, may mga pagdurugo po. Pag titingnan natin ang tongue, red din, at saka ang pulse ay mabilis, rapid pulse. So, ang naapektuhan po nitong init na to ng dugo ay maaari po ang heart. So, pag heart po ang meron, summarize po ito, nagkakaroon ng anxiety, hindi tayo makatulog, mental restlessness, at nagkakaroon ng mouth ulcers. Pag liver naman po, nagkakaroon ng itching with red papules at nagkakaroon ng irritability. Parang ito yung pasyente ko na isang araw. Pag uterus naman po, nagkakaroon ng menorrhagia. So pag intestine naman ang nagkaroon ng blood heat, ito ay magkakaroon ng dugo sa dumi, blood in stools. So alam natin na yung mga organ kung naano ang naapektuhan. So yung blood heat po, ang unang nararamdaman ay siyempre feeling of heat. Tapos nagkakaroon nga po tayo ng skin diseases with red eruption, thirst, bleeding, red tongue, and rapid pulse. So heart blood heat, nagkaroon ng anxiety, mental restlessness, and mouth ulcers. Nag-liver blood heat naman, nagkakaroon tayo ng skin diseases characterized by yung itching. Kasi karaniwan yung itching, di ba, may kasamang hangin yan. At karaniwan na inaatake ng hangin na yung ating liver. Then heat and redness. So pag blood heat in the uterus, nagkakaroon ng blood loss during the period. Blood heat in the intestine, blood in the stools. So yung clinical note po natin, the points liver 2 and spleen 10, yan po yung nagkukul ng blood. Another combination is liver 3 with kidney 2. Ayan pa, no? Yung liver 2 ay para po sa may mga stress, irritability, yung mga madaling magalit, ayan. At saka may mga temporal headache po. May heavy menstruation, merong dizziness, may bladder infection, at meron insomnia. So, liver 2 po gagamitin natin. So, ayan, paano i-locate ang spleen 10? Ayan, paano? Upper border of patella, hanapin po ninyo yung buto. Then, yung dalawang thumb po ninyo, mula dun sa ibabaw ng buto, medial border of the patella. Ayan. So, pag spleen 10 po, ayan po dun, yung pag-locate po natin kanina, no? So, para sa menses issue, pag may bladder infection, pag may eczema, pag may hives, pag may rashes, at may inflammation. Pwede pong i-pressure ang liver 3, liver 2. Yan, pwede po natin i-pressure siya. Yan. Yung liver 3 naman po, ayun, makikita natin. So, para po sa temporal headache, yan, napakabisa din po sa pampababa ng high blood pressure. Yung nagkakaroon ng mga dizziness, mga vertigo, kasi alam naman natin yung liver, pag pinalakas mo yan yung nag-iimbak ng dugo. Ganun din sa swollen and red eyes, kasi responsible sa eyes ay ang liver. Yung may mga depression po, kasi emotion eh. At ang mayroong urinary and genitalia issue. Yung may PMS po, so yung mga tender breast mo, bloated. So yun po ang ating acupressure or acupuncture liver tree. Yan. Sa kidney channel naman po, makikita natin ayun yung kidney 2. Pag kinapa po ninyo yung buto, dali po siyang kapain, ano? Ayan, imagine po ninyo. Yan. Nakakapalan po yan from 1 to 3. 3 ano ng buto ng paa. Okay? So, para real seminal emission, genital itching. Yung kahit naghugas, nangangati pa rin. Yung coughing of blood, okay po yung kidney 2. Sa irregular menstruation din po, okay siya. Sa may diarrhea, tsaka yung uterus prolapse. Kidney 2 is 5 points din po yan. So, sinesedate po natin. Okay. Thank you po.
Thank you very much, Ma'am Mildred. Next, we have tongue diagnosis. Let's call on Ma'am Teresita Sumile from Rizal. She will talk about pale and thin tongues. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. And now we will talk about pale and thin tongues. Lack of blood and body fluids causes decline in volume of tongue body, manifested in thinning, shrinking, contracting of tongue body. Depending on individual's constitution or life circumstances, spleen chi deficiency may lead either to accumulation of dampness or lack of blood. Both are secondary aspects of this harmony of spleen chi. Long-term deficiency will lead to impairment in transformation of food into blood. Because of this, every pale tongue reflects an element of blood deficiency. While blood deficiency is contributory to illness, it results to pale and thin tongue body. Pale and dry for women who suffer from profuse menstrual bleeding, breastfeed for long periods of time, or follow improper dietary habits. Thin pale tongue is a manifestation of individuals who suffer from lack of blood. If not treated, kidney yin deficiency may develop as blood nourishes yin. Development of this pathology is visible when the pale tongue body changes its shape or takes on an intense red or orange tints. If pale tongue is dry, pathology is not so severe. Only blood has lost its moistening function, but the deficiency is not yet significant. Typical symptoms of blood deficiency: dry or itchy skin, hair loss, pale tinge to the skin, numbness in extremities, dizziness. Now let's go to our first patient, a 41 years male, 41 years old. Tongue description: pale red, slightly thin, rolled up edges, slight depression of the root. Symptoms: deep exhaustion, depression, and backache. Background to disease: overwork, hectic lifestyle, emotional problems, excessive sexual activity, and TCM diagnosis are slight spleen chi deficiency with blood deficiency, liver chi constraint, and slight essence deficiency. Okay. Female, next patient is female, 38 years old. Tongue description, pale, thin, curled up edges, reddish center, depression at the root. Symptoms, deep exhaustion, burning around the anus, anal pain, constipation, lack of appetite, and insomnia. Western diagnosis, inflamed hemorrhoids, then background to disease, strong demands at work and home, unhappy marriage, constant frustration, 4 pregnancies, and caffeine abuse. Then TCM diagnoses are spleen Qi deficiency with blood deficiency, liver Qi constraint, heat in the stomach, and essence deficiency. Okay. Then our third patient is a female, 35 years old. Tongue description, pale, thin, pale edges, slight dry, thin crack in the center. Symptoms, exhaustion, acute diarrhea with blood and mucus, hair loss, short menstrual cycle, and intense fears. Western diagnosis, ulcerative colitis. Background to disease, ailments that are improperly treated in India, then emotional problems, vegetarian diet, and fasting. TCM diagnosis, we have slight spleen Qi deficiency with blood deficiency, then liver blood deficiency, and slight stomachian deficiency.
Plus may essence deficiency yan.
Opo, Doc.
Use na
Essence pala, Doc, hindi kidney. Kidney yan.
Ay, hindi. Kasi if you look at the root of the tongue.
Oh, very depressed, Doc.
Letter V na eh.
Opo.
Yeah. So thank you very much, Ma'am Teresita.
Thank you din po, Doctor.
Next, we go to diagnosis by interrogation. Let's listen straight from Baguio to Ma'am Vina Pasqua.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, continuation po ito last week. Mental, emotional symptoms. Day 9, irritability and anger pa rin po. Itong irritability ay common emotional complaint po, and it includes feeling irritable frequently, flying off the handle easily, so feeling frustrated, and similar emotional states sa traditional 7 emotions. Ang itong irritability ay similar to anger, pero mas malawak po yung broader range of emotional states niya, and is generally not so intense. A propensity to anger is generally due to liver pattern, whereas irritability may be caused by many different patterns affecting most organs. So in particular, yung patterns po na nagsasanhi nitong irritability ay una, Qi stagnation, pangalawa, blood stasis, third, liver yang rising, blood deficiency, itong yin deficiency with or without empty heat. Itong heat including damp heat at saka itong empty heat. Kaya po itong irritability may be due to full or empty causes. In general, the irritability from empty causes is mild lang and somewhat vague, whereas the due to full causes is more intense. The interrogation, therefore, should first try to establish the full or empty character of the irritability. In empty conditions po, yung patient, maaring sabihin niya na, I get easily annoyed, or things that did not used to get to me, now do, at saka iba pa. Sa full conditions naman, yung patient may say something like, palagi siyang I always feel irritable. O kaya, I feel so on edge that I take it out on my children, at saka iba pa. So, dito, yung examples ng patterns that may cause irritability and examples of patient's expression. Liver cheese stagnation, maaari ang sabi ng patient ay, I feel extremely irritable before my periods and take it out on my family. Sa lung cheese stagnation naman, parang ang sasabihin niya, nakakaramdam siya ng lump in the throat. And sabi niya, I am on edge and feel like bursting into tear. Sa liver blood stasis po, I sit with resentment. Sa heart blood stasis, ang sasabihin ng patient ay, my mind is constantly judging and I felt resentful and I feel resentful. Then sa liver yang rising, I fly off the handle easily. Sa liver fire naman, I explode into a rage. Sa heart fire, ang nararamdaman niya ay she feels irritable or he feels irritable, impatient, and galit siya. Pag sa lung heat, ramdam po natin sa lungs, I feel frustrated, weepy, and irritable. Sa stomach heat naman, I often feel angry and obsessive. Next, liver blood deficiency. I feel lost, overwhelmed, and on edge, and I can't cope. Sa kidney yin deficiency, sasabihin ng patient, maaring ganito, I feel helpless, unmotivated, and on the edge in the evening. Next po ay heart blood deficiency. Sasabihin ng patient, maaring ganito, I feel sad and on the edge and I can't cope. Kidney yin deficiency with empty heat. I feel hot and bothered. Sa heart yin deficiency naman with empty heat, I feel sad and hot and bothered then. And then sa damp heat, alam na po natin, pag damp, ang sasabihin niya, I feel heavy, yucky, and irritable. Yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. We then go now to pulse diagnosis. Let's listen to Ma'am Mildred. Ma'am Mildred, good afternoon.
Good afternoon po muli. Pagpapatuloy po natin ang ating pag-aaral sa pulse diagnosis. So, balikan po natin ang superficial pulses. Superficial pulse or FUMI. The superficial pulse is a pulse that is superficial. Ibig sabihin, nasa ibabaw lang. Mararamdaman natin sa ibabaw ng ating balat. And it is not felt in the depth and or middle levels, or the strength of the pulse decreases when you press your fingers downward and increases again when the pressure is released again. So, pag pinatong natin sa palapulsuhan, halos yung sa skin lang po yan nararamdaman. Pag diniinan mo, nawawala. Pero pag nirelease po na magaan, mararamdaman uli. The superficial pulse reflects that there is more qi and yang in the exterior aspect of the body. There will be a relative excess of qi and yang in the exterior aspect, either because there is a lack of yin to anchor yang, or because sway or blood is very weak and cannot hold qi down. In this case, the pulse will both superficial and without strength. Yun, nasa ibabaw pero wala siyang lakas. Yang and qi may also be relatively strong in the exterior because there is an invasion of exogenous qi. Ito yung pathogens, yung mga sanhi ng sakit. In this case, the pulse will be more replete because there are struggle between wei qi and zhe qi. So yung lakas natin, yung energy natin sa katawan, lumalaban siya sa mga papasok na sanhi ng sakit. Kaya lumalakas yung pulso. An exemption, though, is if there an invasion of exogenous zhe qi, whereas there is wei qi deficiency. In this situation, the pulse will be superficial in without strength. So pagpapasok yung sanhi ng sakit at malakas siya, pag pinakiramdam natin yung pulso, humihina yung ating wei qi. Kasi ibig sabihin po nun, mahina yung Wei Qi, maaaring makapasok yung sanhi ng sakit. If there is a heat present, the pulse will be rapid. So, bibilis kung mainit na yung pumapasok. The presence of excess cold will result in a pulse that is tight. So, kung cold naman, tight. Extreme yang deficiency can also manifest with superficial pulse. So, yung kakulangan po ng yang sa katawan, pag pinulsuhan mo, superficial din yung mararamdaman. This is a very serious sign and signifies that yin and yang are in process of separating and remaining yang is now drifting outwards. Pero sign po yun na delikado. So yung superficial pulse po, pattern of imbalance, halimbawa yung Qi in the exterior, yung papasok pa lang yung pathogens, nagkakaroon po siya ng yung deficiency, blood deficiency, severe Qi deficiency, and extreme cases, yang deficiency. Yan po yung pag superficial pulse po ang makikita natin. Yan po yung mga papasok, yung pattern of imbalance. So yung typical combination po niyan, pag superficial and tight, wind cold po ang nasa pumapasok na pathogens. Pag superficial and rapid, wind heat. Pag superficial and slow, pwede po itong invasion of exogenous wind. Superficial without strength, so Wei Qi deficiency, yung ating panglaban na enerhiya, kulang. Superficial and empty in the middle or deepest level, ibig sabihin po nito, yung interior deficient condition na. So yung katawan po natin, konti na lang yung ating energy na panlaban. So yun po yung mga mararamdaman natin sa pulse. Ito po yung drum skin. Ano ba yung drum skin? Jimei. Jimei is often translated as drum skin or leather, tympanic or hard pulse. This type of superficial pulse is wider than a normal pulse and it feels hard. So, yun po yung drum skin. It will provide the fingertips with resistance when you press downward. Yung parang lumalaban ba, pag pinrest mo, lumalaban, nararamdaman mong lumalaban. But when you reach the middle level, the resistance disappears. Yan. Pag dinainan mo pa ng konti, yung parang tinutulak yung fingertips mo, nawawala. The width of the pulse will be felt when rolling the fingers laterally back and forth. Yun. Pababalik-balikin mo po yung fingers mo para makapa. The drum skin pulse will felt more laterally than the empty and saggy pulse. It is called a drum skin pulse because the pulse feels hard and wide in the same way that drum skin does. So, yun po yung ibig sabihin, yung mas malawak yung nakakapa mo pag niro-roll mo yung fingers mo. It will also feel empty beneath the hard surface like a drum skin. Yan. The drum skin pulse is not something that you will ordinarily encounter in a normal practice. So it arises when there is a significant loss of blood. So nararamdaman lang po natin yung drum skin kung merong loss of blood. In Chinese medicine, a heavy blood loss will result in an extreme blood deficiency and or yin deficiency, yin shu. This will result in an abundance of yang qi ascending up to the surface. Yan. Tataas yung yang qi kasi nga bumaba yung yin. Yang is expansive in its dynamic. The pulse will therefore be superficial, hard and wide. But because there are extreme deficiency of yin and blood, it will feel empty. Yon. Further down, extreme jing shu can also manifest with this type of pulse, yung jing deficiency, pag kulang na tayo ng jing essence. So, yun po yung drum skin pulse. So, pattern of imbalance po nito pag blood deficiency or yin deficiency, stress or yin shu. Yan, may natutunan po tayo. Thank you po.
Thank you very much, Ma'am Mildred. I'm sure nakatulong po yung
Drum skin.
dalawang, So far we have superficial pulse, and drum skin. Puro po superficial siya. Maraming
Opo.
salamat po. Then we proceed to differential diagnosis. Let's call on Ma'am Needs You, kahit bising-busy, nakakapag-lecture pa rin. Good afternoon po.
Good afternoon, Doc Hector and everyone. Welcome to our TCM Foundation number 193. Phlegm heat obstructing the lungs. Okay po. Etiology, yun yung mga causes, invasion of exterior heat, depressed in the lung, and transforming into heat. Internally produced heat from yin deficiency or chi stagnation from long-term emotional strain. Excessive consumption of greasy and cold raw foods. Okay po. So, possible presenting condition, ito yung may mga bronchial asthma, may acute bronchitis, may pneumonia, and pulmonary emphysema with infection. Okay? Sign and symptoms, cough and panting, barking cough, yung parang tumakahol na ubo, with profuse sticky yellow or green sputum. Shortness of breath, hindi masyadong makahinga, may shortness na. Sweating, pagpapawis, flaring nostrils, expectoration of blood, and or purulent phlegm with fishy smell. Medyo parang may infection na. Kasi medyo amoy isda-isda ba, ganun. Wheezing, feeling of oppression of the chest, feeling of heat, thirst, insomnia, and agitation. Okay? Pulse when you palpate is slippery and rapid. Okay? Yung tongue kapag tiningnan nyo ay red, swollen with a sticky yellow coating. Okay? So the treatment principle for this pattern is to clear and drain phlegm heat. Okay. Acupuncture treatment points to use lung 5, clears heat and phlegm. Lung 10, clears lung heat. Bladder 13, supplements lung chi. Stomach 40, resolves phlegm. LI 4, releases the exterior. Stomach 36, transforms phlegm. Lung 7, restores lung descending function. LI 11, clears lung heat. REN 12, supplements spleen, resolves phlegm. Lung 1, descends lung chi, alleviates the cough. REN 17 or CV17, unbinds chest. Kidney 6, this inhibits the throat. So yung technique ay needle with drainage. And then kapag pwede ring i-prick yung LI 11 to bleed kasi nga mayroong phlegm heat. Thank you very much. I hope you learn. Thank you po.
Thank you very much, Ma'am Needs.
Thank you.
Yeah. Next, we go to acupuncture patterns and practice. We will discuss vertigo and dizziness. So let's define vertigo first. Vertigo is a condition that results from disturbance of the upper orifices induced by wind, fire, phlegm, blood stasis, or a state of deficiency. Main symptoms of vertigo are dizziness and blurring of vision. In mild cases, this dizziness may disappear upon closing the eyes. In more severe cases, the sensation resembles that of seasickness or car sickness. The patient feels as though incessantly rotating and is unable to stand upright. There will be accompanying nausea or vomiting, tinnitus, pallid complexion, and sweating. When very severe, there may be abrupt fainting. Etiology and pathology. First one is hyperactive liver young. The wood element to which the liver belongs tends to ascend and spread. The substance of the liver is yin, but its function is yang. Kidney belongs to water element. If kidney yin is deficient, water is unable to generate wood. And deficiency wind can stir in the interior. Pent-up rage or melancholy may block the movement of liver qi. Blocked liver qi can transform into fire and this will lead to stirring of yin yang. Clinically hyperactive yang also fosters hyperactive liver yang. In all these conditions, liver yang can ascend and disturb the upper orifices and induce vertigo. The next cause is deficient qi and blood. Protracted illness or continued blood loss, of course, makokonsume ang qi and blood, and so there will be deficiency. Insufficiency of spleen and stomach may compromise the sources for qi and blood generation. Alam naman natin na dyan po tayo nagdidepend ng pag-produce ng blood, no? Spleen and stomach. If qi is deficient, pure yang cannot act effectively. If blood is insufficient, upper orifices may not be properly nourished. In all these circumstances, vertigo may result. Next is insufficient kidney essence. The kidney is the foundation of prenatal heredity. And the functions of the kidney are storing essence and generating marrow. If prenatal heredity is inadequate, kidney essence is insufficient. Chronic illness afflicts the elderly, or excessive sexual activity wears down kidney essence. So ingat-ingat, wag masyadong sobra, no? Sea of marrow becomes depleted, and so nawawala ng nourishment ng brain. So too much sex can also give you vertigo. Blockage by phlegm dampness. Addiction to alcohol, fatty or sweet foods, of course, alam natin, can injure spleen and stomach. Irregular starvation and satiation or physical exhaustion also injures spleen and stomach. Impairment of spleen and stomach functions, magkakaroon tayo, of course, ng endogenous phlegm and dampness. And so, these two will obscure the upper orifices. So, pag obscure na yung upper orifices, magkakaroon tayo ng vertigo. Blood stasis. So if you had traumatic injury of the head and the brain, this can cause blood to overflow its channels. And so magkakaroon tayo ng static blood. In turn, static blood from this or another cause can obstruct brain blood channels, and this will lead to loss of nourishment of the upper orifices. So you will have vertigo. And this will be severe if phlegm joins blood stasis in obstructing the upper orifices. Actually, makakapa mo talaga yung bukol. Meron po kasi ako isang client, lady, ano siya, pulis siya na babae, no? In her 40s. May nakapa ako dun sa ulo. Yung pala sa mga training nila. So, dati do yun masakit. Ngayon may bukol na. Ayaw magpa-check sa neuro. So, yun, kaya may vertigo siya parate, hindi din siya makatulog. In summary, the location of the illness pag may vertigo tayo is nasa our upper orifices. But the cause ng vertigo involves the liver, the spleen, and the stomach. The basic pathological mechanism is depletion of brain marrow, leading to nourishment of the upper orifices or upward attack by phlegm and fire. Thank you very much. Okay, if you have questions, you may write them on the chat box. We will answer them later. Thank you. We then proceed to signs and symptoms, and we are honored to have, wait lang po. Ma'am Vina Pasqua from Baguio to give the presentation for signs and symptoms. Let's welcome again Ma'am Vina.
So good afternoon po, Doctor. Good afternoon po sa lahat. Signs and symptoms po tayo, day 85. Ang topic ay pale palindrome at saka yung red palindrome po. Pag sinabi po itong palindrome, ito yung vertical groove between the base of the nose and the border of the upper lip. Pag pale po yung palindrome, indicates either Qi deficiency or cold, which may be full o kaya ay empty type. Pag Qi deficiency naman, pale plethrum, tiredness, poor appetite, loose stools, mahina po ang boses, pale din yung kanyang dila, empty ang pulso. Other symptoms and signs depende po sa organ involved. Then, punta tayo sa full cold. Bright pale plethrum, greenish pale complexion, abdominal pain, epigastric pain, cold limbs, pain that is aggravated by exposure to heat and by drinking. Pag mainit po yung, medyo maligam-gam po yung inumin niya. And that is aggravated by exposure to cold and by drinking cold drinks. Malapad at makapal po ang tongue coating. Malapad at puti. Makapal. Tight pulse, other symptoms and signs, depende po sa organ involved. Then punta tayo sa empty cold. Pale plethrum, greenish pale complexion, abdominal pain, dull epigastric pain, cold limbs, pain that is aggravated by exposure to heat and by drinking warm drinks, and that is aggravated by exposure to cold and by drinking cold drinks. So, nakakaramdam siya ng maginaw, pagkapagod, pale tongue with thin white tongue coating. Ang pulso po ay deep weak. Other symptoms and signs depende po sa organ involved. Then ito naman, red plethrum indicates either blood heat, often in the uterus, or in acute cases, external invasion of wind heat. Then itong heat in the blood, red plethrum, skin rashes, feeling of heat, thirst, may bleeding na, mental restlessness, pula po ang kanyang dila, at ang pulso ay overflowing rapid. Then next po ay punta tayo sa invasion of wind heat. Red plethrum, aversion to cold, fever, sore throat, headache, body aches. Ay slight lang ang sweating niya. A tongue with red sides and o kaya sa front. At ang pulso po ay rapid floating. Then itong last po natin ay damp heat in the intestines. Red plethrum with skin spots that ooze fluid. So lumalabas na yung fluid. Abdominal pain that is not relieved by a bowel movement. Diarrhea, mucus, and blood and stools. Offensive din po yung amoy ng stools niya. Burning in the anus, scanty dark urine, my fever, sweating that does not decrease the fever, a feeling of heat, thirst without a desire to drink, feeling of heaviness of the body and limbs. So pula po ang kanyang dila, dahil nga may heat with sticky yellow coating and slippery rapid pulse. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. We now go to BPH, benign prostatic hyperplasia, to be presented by Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita ulit.
Good afternoon ulit, Dr. Hector and classmates. Welcome to benign prostatic hyperplasia, and now let us talk about pathology. Sa part 3 na po tayo, continuation ito last week. Pathology of benign prostatic hyperplasia in Chinese medicine. The pathology of BPH is complex, and it is always characterized by emptiness and fullness, deficiency of kidneys, spleen, and lungs. A kidney deficiency is always at the root of BPH because it affects the prostate in two ways. First, a deficient kidney fails to transport, and excrete fluids in the lower burner, resulting in accumulation of fluids and eventually dampness and phlegm. Secondly, the seminal fluid in the prostate is a manifestation of Changi, which originates from the kidneys. In addition to a kidney deficiency, there may also be a deficiency of the lungs and or spleen. A deficient lung fails to make fluids descend, and a deficient spleen fails to transform fluids. This leads to the formation of dampness and phlegm. A deficiency of the kidneys, spleen, and lungs leads to the impairment of the transformation, transportation, and excretion of fluids, and therefore to dampness and phlegm accumulating in the prostate. The symptoms of phlegm accumulation in the men's genital system are as follows: prostatic hypertrophy, venous Peyronie's disease, priapism, impotence, only some cases of impotence, and then sweaty genitals. Now let's go to stasis of essence or G. An important feature of BPH is that there is a pathology not only the fluids but also of essence or G. It is interesting that although the ancient Chinese did not have a knowledge of the prostate and seminal vesicles, they were aware of the difference between urethral discharges of urine and of sperm. Urethral discharges of urine pertain to the pathology of painful urination syndrome and therefore of body fluids. By contrast, urethral discharges of sperm pertain to the pathology of essence and are generally due to the weakness of the sperm gate. The term turbidity is often mentioned in Chinese medicine and especially in the context of diseases of the lower burner. In urinary diseases, turbidity indicates a pathologic state of the fluids in the lower burner. This occurs when there is an impairment in the transformation, transportation, and excretion of fluids in the lower burner. In these contexts, turbidity manifests not only with turbid urine, but also with urinary difficulty. In genital diseases such as prostatitis and BPH, turbidity refers to a pathology of essence. In this context, it manifests with urethral discharges of sperm, prostatitis, and BPH. In both urinary and genital diseases, turbidity also refers to retention of chronic dampness. Although we are more used to thinking of the essence as a pure, precious fluid that is inherited from the parents, the essence plays a role in the physiological and pathology of men's genital system in the same way that blood does in women. As a result, essence in men can become stagnant and be affected by turbidity. Okay, so here is an illustration where men blood stasis in women and stasis of essence and in men. So it starts from the kidneys, then Chan Gi, then room of Jing, and then yun na. Again, blood stasis of the Jing to the prostate. And then for women, still starts from the kidneys, then the Chan Gi, then uterus, and blood chamber. Okay, yun po. Yan lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. So with that, we would like to thank everyone for joining. And you may ask your questions now on the group chat, on the chat box. Thank you to our presenters. Good afternoon, everyone.